But first, the dire situation in Manitoba. Premier Brian Pallister and the Mayor of Winnipeg, Brian Bowman, spoke with Prime Minister Justin Trudeau this morning. Both are asking for more resources to help fight record levels of COVID cases and ICU admissions. Minister LeBlanc, welcome back to the show.
Hi, David.
I'd like to start with the situation in Manitoba, if we could. Premier Brian Pallister spoke with the Prime Minister today and has requested help of up to 50 critical care nurses, 20 respiratory therapists, and up to 50 contact tracers from Statistics Canada. Will you be able to provide that help to Manitoba?
I hope so. I expect so. We obviously have said to premiers across the country for almost a year and a half since the pandemic began that we're here to help. We'll do everything we can as a national government to support them financially, to support Canadians financially, but also, and very importantly, with backup or redundant systems like medical supplies, like medical equipment and medical personnel. So we were able to help Ontario, and I know the Public Health Agency is looking right now across the Government of Canada as to how quickly we can bring together these personnel. We may also have other provinces that are able to volunteer help, and the Government of Canada will assume those costs and obviously move these healthcare professionals to Manitoba as well. So we'll be working all weekend to get to a yes.
I wonder, though, given the deployment to Ontario, which was larger in raw numbers because of the need and the population size, whether the capacity exists. Do you know what I mean? Like, or has it largely been deployed to Ontario already?
Yeah, we don't think that certainly the capacity hasn't been depleted. Obviously, the easiest personnel that we could access across the federal government system in many cases have been sent to Ontario. But I'm very confident, David, that in the coming next couple of days, literally over the weekend, we'll do what's necessary to support the Government of Manitoba. So we're working on that today. But I'm confident that we'll be able to provide them the support they need, from contact tracing, as you said, to medical professionals. The challenge is a number of these specific healthcare professionals have very precise certifications to perform certain important medical functions. So we'll also work with other provinces. I was frankly very reassured by the reaction from many provinces, and including your home province of Newfoundland and Labrador, around helping out other provinces. So we think that the same goodwill exists, obviously, for our friends in Manitoba. So we'll all be working very hard to get them the help they need.
I want to switch to something else that you're likely working on throughout the weekend, and that's the Moderna shipments, because there's a real lack of clarity right now over whether or not the country will receive, how much they'll receive of the 10 million or so doses we're supposed to get from Moderna by the end of June. How worried should we be about this, that there's such a lack of clarity on the shipments this close towards the end of this quarter?
I mean, obviously, we understand the concern and the impatience of people to be able to get vaccinated, and in many cases, to receive their second dose, to be fully vaccinated. So our work will not stop until we have more precise delivery dates from Moderna. My colleague, Anita Anand, the Minister of Procurement, has already a meeting planned with them first thing on Tuesday to impress upon them the importance of giving us, as best as is possible, details on these delivery dates. We're confident at the end, David, that we'll get all the doses we need for every Canadian, as we've said, to have at least a first dose of the vaccine by the end of June. And to complete the vaccination by the end of September. Moderna has had a number of challenges with respect to supply chains, scaling up the production. There are 94 different ingredients in the Moderna vaccine, we were told. So this is a normal but understandably frustrating circumstance. But in the end, we have no reason to think Moderna won't be able to meet its obligations to Canada and to Canadians. So we'll continue to do what's necessary with the company to get those doses as quickly as possible. 1,100,000 Moderna doses arrived in Canada earlier today, and we do expect many, many more millions from Moderna as we go into June, and we'll have more information at the beginning of next week.
Well, that's what I'm wondering. Like, what's Canada's exposure here in terms of loss of doses? Because it's supposed to be 10 million by the end of June, and they may eventually be able to meet their commitment. But between now and then, are we talking about getting less than 10 million? Are we talking about getting almost none of the 10 million, or just getting it a little bit later? I mean, do you have a sense of how exposed we are here in terms of the supply leading up to the end of the second quarter?
Yeah, very good question. I mean, certainly the idea that we would have almost no doses or whatever, however you phrased it, between now and the end of June, we have no reason to think is the case at all. Moderna is telling us that they are on track to meet their commitments to Canada and to Canadians. The challenge is to know the arrival date, the actual delivery date. Is it June 7th and then again on June 12th, or is it June 10th and June 13th? So those are the level of sort of granular detail that obviously provinces need to be able to scale up their vaccination program. So that's why we know how important it is, but we'll have much more information, we hope, by the beginning of next week from the company. But we're not worried that there's going to be a massive shortfall in terms of what they committed to Canada between now and the end of June. It's just getting precise, reliable data on what date in June these millions of doses will arrive.
Okay, so Minister, while you guys work on trying to get vaccines into the country from Moderna, there are some Canadians who want to be able to leave the country to get vaccines. And Windsor Mayor Drew Dilkens has talked about this. They want people to be able to go across the border. If you live in a border city, get a vaccine from an American source if you can, and then not have to quarantine if you come back. Have it treated as an essential medical service. If that option is there for Canadians, will you find a way to make it happen?
Well, we're obviously in ongoing conversations, David, with American authorities. In some cases, the U.S. border services have not allowed Canadians to travel to the United States, to enter the United States, because in their judgment, receiving a vaccine didn't meet the exemption for essential medical treatments. Everybody understood that to be the sort of unique or rare cancer therapy that might be available in a clinical trial in the United States, or some surgery that perhaps wasn't available in Canada. Those were the kind of exemptions that were contemplated. We have continued to say, and Dr. New said it in the news conference again earlier today, it's not recommended for people to cross international borders at this time. People should avoid all travel unless the travel is absolutely essential. And if we had 4.5 million doses of vaccine arrive in Canada this week, many more millions in the coming weeks. We think it's safe and effective to stay in Canada and to wait for your vaccine turn to come. But there are ongoing conversations with the American administration about ideally getting access to some of those surplus vaccine doses and having them shipped to Canada, where Canadian health authorities can safely administer them to people in the communities in which they live in Canada. That's certainly a sort of our privileged option, but we'll continue to do what's necessary to get Canadians vaccinated as quickly as possible.
But is that the priority in those conversations with the Americans? Bring the vaccines to Canada rather than let the Canadians go to the vaccines?
Yeah, that's been an ongoing conversation with the American administration around how could we access surplus doses there, in many cases to honor the contractual obligations the companies have to Canada. So that is, according to public health experts, David, the sort of safer, preferable option. But there have been some examples. I had a conversation with Premier Pallister of Manitoba some weeks ago around this. The example of truck drivers who crossed the border being vaccinated in the United States. So there may be examples that local public health authorities and American authorities agree are appropriate. But our priority is to get as many vaccines into Canada as quickly as possible.
Okay, I want to touch on one more topic before I let you go, and that's the extension of the flight ban, the direct flight ban of flights from India and Pakistan extended until June 21st, I believe. You've done this sort of the day before it was set to expire. I wonder if a decision on whether it gets rolled over again will be made and announced far enough in advance, because we have heard stories of people who are stuck over there, right, who want to come back, and there don't appear to be any repatriation efforts. I mean, what steps will you take to deal with people who may be stranded because of this, if any? And do you think you might make an announcement on whether this rolls over again further in advance than 24 hours?
So it certainly is a challenge, David, to get the orders in council, or the no TAM orders in the case of these flights, approved based on public health advice that comes to the government. We're constantly looking, because the 21st of the month is the anniversary when we roll over these orders in council around border measures, quarantine orders, and so on. The evidence we have and the advice we have from public health authorities is that it would be unwise to have direct flights because of the high case positivity level and because of the number of variants of concern that were detected at arrival points. So we'll continue to make those decisions as we have to protect Canadians. At the end of the day, it is not recommended to travel. We have said from the beginning that people should not be traveling for non-essential purposes. We've also said that whether it was sun destinations in the Caribbean or flights from India and Pakistan, these rules can change at any time based on the advice the government gets from scientists and doctors. So we recognize that it's difficult, but we certainly don't apologize for having to take these steps necessary to protect Canadians, and we'll continue to do so for as long as it takes.
Okay, Minister LeBlanc, thank you for your time.
Have a great weekend, David. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.